Hey everyone, today we're going to talk about something you do all the time but maybe don't think about as a core clinical skill, the sign-out. Now look, it's so easy to see it as just paperwork, the last hurdle before you can finally go home, but we're going to flip that script. The sign-out is a critical procedure, just as important as any other. It's a moment that defines your professionalism and, most importantly, directly impacts the safety of your patients. Ready? Let's get into it.
This quote just says it all, doesn't it? This isn't just a courtesy to your colleague. It's a clinical imperative. It's a non-negotiable part of the job, a core competency you absolutely have to master. Because when sign-outs go wrong, the consequences, well, they can be really, really serious.
So, why are we hammering this so hard? Let's just put a number on it. 480. If you're a resident and you've got, say, 4 to 8 patients, you could be doing up to 480 sign-outs in a single month. Just think about that. 480 times you are literally handing over responsibility for a person's life and well-being. When you do something that frequently, you don't just have to be good at it, you have to be incredible at it.
So here's our game plan. First, we're going to really cement why this is a critical procedure. Then, we'll talk about the sign-out as a two-way street. It's a conversation, not a monologue. After that, we'll get into a fantastic tool called iPass that will change the way you do handoffs. And finally, we'll talk about how all this shapes you as a professional.
Okay, let's dive into that first big idea. Treating the sign-out with the exact same focus and respect you'd give to any other medical procedure.
I love this analogy. The best way to think about a handoff is a relay race. You've been running your leg, you're sprinting, you're taking care of your patient. The sign-out, that is the moment you pass the baton, the complete responsibility for that patient's care to the next runner. And we've all seen a relay race, right? The whole thing can be won or lost in that split second of exchange. A clean pass is absolutely everything.
Because this is what happens when you drop the baton. A fumbled handoff isn't just awkward or inefficient. It's a moment of pure vulnerability for the patient. It can lead to actual, tangible harm. We're talking about delayed care, longer hospital stays, and even serious medical complications. These are the things that keep us up at night, and a solid sign-out is one of our best defenses against them.
So, let's get into the nuts and bolts. A truly safe sign-out is not a one-way data dump where you just talk at your colleague. No way. It has to be a dynamic, back-and-forth process. It's a two-way street.
And that street has two very clear lanes. The outbound sign-out, or OSO, that's you, before you leave, giving a great summary of your patients. But then, when you come back, you get the inbound sign-out, the ISO. That's your colleague giving you the quick update on what happened while you were gone. You see how that works? It closes the loop. It ensures that nothing and no one falls through the cracks.
Now, for this two-way street to work, there are some ground rules, some absolute must-haves. First, it has to be verbal. Face-to-face is always best. Second, it's got to be written too. Bring 2 printed copies, one for you, one for them. Third, for your sickest, most critical patients, you need to do this at the bedside. And finally, it absolutely has to be interactive. You have to build in time for questions. It's a dialogue.
Okay, so that's a lot to remember, right? Especially at the end of a long, chaotic shift. How do you make sure you're consistent and safe every single time? Well, you need a system. You need a structured framework. And that's exactly where a tool like iPass comes in.
Think of iPass as the rules of the road for that two-way street we just talked about. It's a simple mnemonic, a checklist, that gives every single handoff a reliable structure. It means the person signing out knows what to say, and the person coming on knows what to listen for. It's a game changer for making sure nothing critical gets forgotten.
So let's break it down. iPass. First, I is for illness severity. You lead with this. Is the patient stable, a watcher, or unstable? This sets the priority immediately. P is for patient summary. This is the one-liner, the elevator pitch of the patient's story. A is the action list. This is your crystal clear, prioritized to-do list. The first S stands for situational awareness. This is huge. This is where you do the if this, then that planning. You anticipate problems. And that final S, it's synthesis by receiver. The incoming doc repeats the plan back to you. That's the handshake that confirms the baton was passed securely. It's brilliant.
All right, this brings us to our last section, because getting good at something like iPass and the whole sign-out process, it's about more than just patient safety. It's about you. It speaks volumes about the kind of doctor you are. I want you to really let this sink in. Your sign-out is your professional brand. Every time you give a handoff,
You are sending a message to your colleagues. A rushed, sloppy sign-out says one thing, but a clear, organized, thoughtful one, it tells everyone that you are diligent, that you care deeply about your patients, and that you are a proactive, trustworthy teammate. It's how you build a great reputation.
And professionalism is all about action. This slide breaks it down perfectly. On the left, that's your pre-flight checklist. These are the things you do before you go. You place the orders, you get the IV access. You never ever leave these kinds of tasks for your colleague. That's just not how great teammates operate. And on the right, that's what has to be in your written report, so your colleague has the complete picture to take over safely.
And you know what? This whole process can be incredibly efficient. It has a nice rhythm to it. You start with preparation, then comes the handoff itself, your OSO, which should really only take about 90 seconds per patient once you get good at it. Then your colleague covers, and when you get back, you get that super quick ISO, maybe 45 seconds per patient. It's a smooth, professional cycle. So if you forget everything else, remember this one thing. Mastering the sign-out does two incredible things at once. First, and most importantly, it protects your patients. It wraps them in a blanket of safety. And at the exact same time, it builds your professional brand as a reliable, caring, and excellent physician.
Which brings us right here. I want you to think right now, based on everything we just talked about, from the relay race to iPass, what is the one single thing you will change in your very next sign-out? Not next month, not next week, your next shift. Pick one thing and commit to it. Because that's how we improve, one safe handoff at a time.